Good afternoon, sir. I am K. Panchal, Additional Director from Government of Gujarat, Commissioner of Health. The goal of e-Mamta is to reduce the maternal mortality and child mortality in the state, and in turn it will reduce the maternal mortality and child mortality of the India also. Our state government is celebrating this year as a golden jubilee year of the formation of the Gujarat state, and the goal of the state government is also to improve the human development index of the Gujarat state. Fire behind for the social indicator. To improve this human development index, we have to improve the GDP, health index as well as the education index. So I am dealing with the health index. To improve the health index, our main goal is to reduce the maternal mortality and child mortality. Once we capture this data, once we improve this maternal mortality and child mortality, our health index can be improved, the life expectancy at the birth can improve. So with this short brief introduction, let's go to the next slide. The e-Mamta is a management tool to plan, deliver and monitor the entire RCH activity. Plan means we have conducted the family health survey. So we are in the Gujarat state we have a 5.87 crore population. Out of 5.87 crore population, 4.83 population is already captured in our e-Mamta. So that is our plan. Delivery, all the antenatal care services, first ANC, second ANC, third ANC, delivery, PNC, immunization, malnutrition, anemia, all these delivery sessions we are monitoring through this e-Mamta. There is a work plan available in this e-Mamta. The work plan will give the list of beneficiaries whose due services are available for that particular village. And that due services we are monitoring through our monitoring program. Just I will show you through the documentary that we have prepared for this.
Maternal mortality and infant mortality are the important public health challenges of today. Tracking of pregnant mothers is essential in providing effective healthcare services to them. Children too need to be tracked for giving them essential medical care. Gujarat has developed many successful socio-economic development models, especially during the last decade, for the welfare of the people. Many of these programs are easily adaptable, and looking at the great success Gujarat has achieved, many of these programs have already been replicated in other parts of the country. The State Rural Health Mission under the Health and Family Welfare Department of Government of Gujarat has given shape to an information management system called e-Mamta to improve maternal and child health services with the technical collaboration of NIC.
e-Mamta is the initiative which ultimately would help improvement in human development index and the ultimate goal of seeing well-being of all in the state.
The mammoth e-Mamta program covers about 13 lakh births and 80 lakh children every year in the age group of 0 to 6 years, ensuring safe motherhood and child survival. The implementation of the program is through 1,090 public health centers, 7,274 sub-centers, 283 community health centers and 26 district hospitals, covering 18,066 villages, 172 nagar palikas and 7 corporations of the state. The software provides for individual case-based tracking of all the pregnant mothers and children. From antenatal care to postnatal care of mother, the application covers the entire continuum of services, including child immunization, nutrition, and family planning services. The population of Gujarat have already been entered into the system through Family Health Survey. The data collected is validated through physical verification and cross-verification by district and block officials. Registration. All women who are pregnant and children up to 6 years are registered and provided a unique mother or child ID. Work plans to track services. All the healthcare services provided to the pregnant mothers are tracked through a unique system of work plans. The concept of work plan was introduced for the first time in public health through e-Mamta. Work plans are handy.
Any question from anybody? Yeah.
So this probably is a platform which should have been used a few years ago. Now you are really beyond competition stage. You probably should have been accepted a few years ago for the finalist award.
Thank you, sir.
Sure, it's good project.
Government of India has just now replicated. Before 3 months only they have replicated to all the states. And I myself imparted training to all the Government of India's officers. The beauty of this software is that it is developed by the NIC. That we have not paid single naya paisa to any party for development of this software. And we have during the 4 days training, we have completed 2 trainings for all the states officials of the NIC as well as the Health and Family Welfare Department of all the states. 2 days training we have conducted at the Delhi, and 4 days training we have imparted in our Gandhinagar, where for 4 days training 26 state officials came to Gandhinagar and we have imparted this training. The beauty is that we have given source code of this e-Mamta to all the states as free of cost. We have given the source code to them also, so that they can change, they can edit this module and they can work with this module. Our main goal is to reduce the maternal mortality and child mortality.
One of the first steps towards improvement of Human Development Index is MMR.
Yeah.
You get full points, of course, for the quality of presentation.
Thank you, sir. Thank you.
The idea is probably not new. The idea is digitization of the services, recording of the data in a digital format. The challenge would be to get all the population people on the computerized records, number one. Number two is once you have the information, you have to act on it to make it better. I think that is a challenge, and if there is a will, there is a way.
How it will be work. It is not only that you have completed the family health survey only. Nowadays, all the PHCs are generating the work plan and distributing to all the ANM. And ANM is in turn completing this work plan after providing all the services and returning back to the PHC. So our entire monitoring system we have changed. Previously what our medical officer were doing, as she has already pointed out that ASA was sending, actually ASA is not sending any information, ASA is not supposed to collect any information. Our ANM or FSW are compiling this monthly report, sending to the medical officer. Medical officer review all this performance on the basis of information compiled through the FSW. But now our medical officer is generating the work plan, work plan will be printed at the PHC and it will be given to all the FSW. FSW has to see whether this pregnant woman is available in her village or not. If she is not available, then she has to report. She has to send the SMS where she has gone. If she got some information that she has gone to Dahod, she will send the SMS to Dahod medical officer and they will provide the services.
All the same systems were available, say 2 years, 3 years ago, in a non-digitized format. The information would be with the officer, senior officer, and the Anganwadi worker or the person at ground level would also get the instructions from the senior person. And she's supposed to get back to them with the feedback. But there is inertia by the person at the ground level to carry out the instructions and get back to them in time. And that's where the will and that's where the desire by the superiors is to get things going. The availability of digital records is only availability of data. Without having to wait for the file to come down, the lower person can act on it.
Yeah.
So that cuts out the time delay, and that means the person who is really honest in the system at least has got something to work upon.
Okay.
So that helps.
Okay.
That
Okay.
helps.
Thank you.
Sure.
Thank you, sir.
I think we are done with the regular list, but we have the Bangladeshi contestant about mobile phone health services.